Welcome to Health Uncensored. I'm Dr. Drew, and on today's episode, we'll be taking you to one of the most remote locations in the country that has created a health retreat unlike any other. We'll also be diving into the world of senior communities, maybe learn some do's and don'ts for choosing the right one for your loved ones. Then discover some innovations providing a little relief to us healthcare workers, and wrap everything up together with technology that may just save your life. Wellness and luxury are two things that, at least in my book, go hand in hand. So when I heard that one of the most elite lodges in the country was partnering up with one of the top-ranked hospitals in the nation, I knew we had to investigate this for ourselves.
Well, Three Forks Ranch has existed since about 1865. When we first bought the ranch, we had a small hunting operation. And when the guys would come hunt and then show their wives the pictures when they got home, the wife says, "You're not going there without me anymore." And that's why we built the lodge and the spa and the whole wellness facility.
At Three Forks, we see wellness in everything that we do.
We know that our guests have always come for that outdoor recreation space, and now that wellness piece complements it just the same.
We thought using AI and using some predictive tools, we could provide a service. A guest would come and we could do either a wellness retreat or assessment or a longevity retreat or assessment using some early diagnostic tools that can predict chronic disease before symptoms arise.
Everything that we do here at Three Forks is directly modeled after programs that they have at Mayo Clinic. The wellness retreat really focuses on establishing a baseline for our guests of where they're at with their health. We have a treadmill stress test, a strength test, we have different balance and mobility tests. The longevity retreat is 4 days of really focusing on wellness and predictive testing, really tailored towards living a long and healthy life.
I feel like there's a little bit of something for everyone.
Hydrotherapy spa, salt room, workout classes, nutrition classes, cooking classes.
We're very unique because we're the only ones that really talk about early diagnosis using Mayo Clinic's tools and early prediction. I think that's what sets us apart from everybody else. Mayo's the #1 hospital system in the world.
Wellness goes way beyond where we're at right now, but we're trying to spearhead what people do take initiative for within the wellness side. And if that's a driving force to bring folks to Three Forks, by all means.
I am delighted to be seated today with a 37-year practicing Mayo Clinic physician, Dr. Mike Harper, who also happens to be the medical director at Three Forks Ranch, and Jen Clements, the general manager that will be moving this program forward starting February 2024. Thank you both for being here. Such an exciting program. I've been telling everybody that I barely made it to this interview because I wanted to get on a plane and go to Three Forks. It is so beautiful and compelling. Congratulations. How did this partnership develop with the Mayo Clinic?
So we actually started in 2019 when we decided to try to transplant our healthy living program we developed at Mayo for a number of years to a new and exciting environment, one that's more conducive to getting the consumer who's interested in health and wellness.
So it's amazing. We're open year-round, right? In the summer, we're fishing on 26 miles of private water. We hike, we bike, we do archery, all sorts of shooting sports, anything you can imagine. The winter, we downhill ski, snowshoeing, cross-country skiing, anything you can imagine outdoors we're doing.
I'm going. How has this been? What do you hope the impact of the program is going to be, Jen?
You know, I really hope that it changes people's lives. I mean, we've seen with the number of guests and friends of Three Forks that we've sent to Mayo that we truly have changed people's lives. And the owner of Three Forks Ranch, David Pratt, is passionate about Mayo Clinic. He's passionate about health and wellness. But I think that we have the ability to bring joy to people's lives by coming to Three Forks Ranch and then actually give them the gift of health by getting them that direct access to Mayo.
But there's some really cool, innovative things that are coming up now that we also have utilized. One is multi-cancer early detection blood screening test. And we also do a unique thing that's been developed at Mayo, and that is a routine EKG or ECG that helps you predict the risk of other cardiac conditions like atrial fibrillation, aortic stenosis, heart failure, even some non-cardiac conditions like cirrhosis or a rare abnormality of protein metabolism called amyloidosis, all can be detected, or at least the risk of those can be detected by this AI algorithm on an ECG.
And Jen, I noticed nutrition is part of the program.
It is. We have an unbelievable kitchen academy, 12-station cooking school, and we have an entire Mayo Clinic healthy living menu that we're teaching our guests, but we really try to make it sustainable, whereby we're teaching people skills they can take home, right?
Yeah.
We're moderation over deprivation, and really trying to make it something that you can take home and,
Ooh, I like
and live
that,
with.
moderation over deprivation.
Yeah.
I'm going to use that.
It's good, right?
It's very
I
good.
mean,
And I also, the gym seemed, I'm a kind of a gym rat through most of my life, and the gym looked excellent. Do you train people there also on how to use proper weight training?
We do, and our health coaches and our trainers and people who work with the guests are all highly trained themselves. And as you know, with all the technology that's available now and virtual care and all this other kind of stuff, we really have the ability to not require people to come out of their chosen environment and come to a healthcare facility. And we also know that people are having a harder time getting access to those traditional healthcare facilities. So we need to figure out how to bring it to the patient, so to speak.
I'm glad you mentioned bringing it to the patient. I've been feeling, most of our career, I'm sure you appreciate this, we're sort of trying to fight off all the influences on healthcare. And I think it is time we put it in the hands of the patient, bring it just to the patient. Jen, what do you say?
Truly our differentiator is we get the data, we get the results, you may do the Grail screening, but then you have a pathway into Mayo to deal with that data and to, have, whether it's solving a problem or a second opinion. So that's the differentiator for us, is that knowledge that we get from Mayo and something to do with the results versus just leaving you in the lurch.
I feel like I want to go. I don't know if that's all I've left out is getting over to visit you guys.
So congratulations, both of you. Thank you so much for being here. I really appreciate it, and I can't wait to visit you, and I kid you not.
For more information on the Mayo Clinic, or if you'd like to book a wellness retreat at Three Forks Ranch, visit Three Forks Ranch, and the word 3 is spelled out, threeforksranch.com, or visit the website here at Health Uncensored. And still ahead, we'll get a look at another type of retreat, but exclusively for seniors. Don't go anywhere. Healthcare workers may have found a solution to some overbearing problems.